BCS classification of the drugs to be considered for the evaluation of risk on the bioequivalence. Welcome dear viewers to the video on BCS classes and their risk onto the bioequivalence. Bioequivalence is the study which is aimed to compare the bioavailability of the two formulations. The formulations may be with the similar design or with different design, and generally bioequivalence is required to have the therapeutic comparability or demonstration of the similarity of the therapeutic effect between the formulations. For generic formulations, bioequivalence testing is must, and bioequivalence risk evaluation is dependent onto the formulation and onto the BCS classification. There are 4 classes as per the BCS. The BCS classification divides the drug molecules into 4 classes based on the solubility and permeability. Let's start with BCS class 1. These molecules have the high solubility and high permeability. That's why the B risk is low. Rapid dissolution and absorption formulation changes are unlikely to impact the B. So for BCS class 1 drugs, generally the risk for the bioequivalence is low, but it is not like that. The BCS class 1 drug formulations will not fail. It depends on to other many factors also. But if you consider the BCS class 1 drugs are having low risk for the bioequivalence. BCS class 2 drugs, these have the low solubility and high permeability. So B risk may be medium or high for these molecules. If BCS class 2 drugs are having the pH dependent solubility, that time the risk will be high. For BCS class 2 drug molecules, dissolution is a rate limiting step, and variations in the particle size, polymorph and formulation can affect the B. BCS class 3 drugs, these have the high solubility but permeability is low. So B risk may be medium or high. Permeability is a rate limiting step considering the BCS class 3 drug molecules, and if the excipient have impact onto the permeability, then minor excipient changes or transit time can affect absorption and B. BCS class 4 drugs, these have low solubility and low permeability. So B risk is always high for BCS class 4 drugs. Poor solubility and poor permeability makes absorption highly variable and formulation becomes challenging. Many of the times, dissolution enhancement is done by solubility improvement techniques for the BCS class 2 and 4 drugs. So BCS class 1 drugs are safest for the biowaivers also. Also, BCS class 3 drugs can be applied for the biowaiver and biowaiver can be granted because BCS class 1 and 3 drugs are highly soluble. There is no biowaiver for BCS class 2 and 4 because of the low solubility. BCS class 2 and 3 have the medium risk or moderate risk and require careful control of the formulation. BCS class 4 drugs are high risk products. If the formulation contains BCS class 4 drug, it will be high risk product and it has highest B risk, often requires full in vivo B testing. So this is the information regarding BCS classes and their risk onto the bioequivalence. Thank you for watching the video.